I work in public health, and so I'm worried about what's killing people and what's making people sick. And what's killing people, if you look at the top at least 5 causes, heart disease is number 1, cancer is number 2, injuries are number 3. We'll actually talk a little bit about injuries too, stroke and chronic lower respiratory disease. These are chronic diseases, right? These are things that are not infectious, they're not spread by human-to-human contact. And so when we think in public health about what can we do when it comes to chronic diseases, we think about what causes them. And so when it comes to chronic disease, age is a big risk factor. Your genetics is another one, your diet, exercise, smoking, alcohol, environmental factors, stress, and sleep. But we can't control things like our age or our family history or maybe our stress levels. That's arguable. So what does that leave? That leaves things like diet and exercise and smoking and alcohol, and these are behaviors. So if you think about behaviors, we've been talking about how to eat healthy and exercise for a long time.
You know that the average person in this great land of America, they have no conception of what this wonderful body that the good Lord above has given us, what it's made of, and how to keep it in repair, what foods we should be using in order to help this body to be more useful instead of getting older every day. Am I right? You get down to your favorite supermarket or chain store today, and you just watch the people as they buy their groceries and take a peek into the shopping cart, then watch the person that's pushing that cart. And you can see that the healthy, happy, handsome people are the ones that have the natural foods in that shopping cart. And the people on the other hand, the ones that are completely out of condition.
All right. So maybe the message is if you want to be handsome, you should eat healthy. I don't know. The reason I showed you this is because we have been talking about healthy behaviors. That's from the 1950s. And I'm going to fast forward a little bit to this. I'm going to show you a series of maps. It starts in 2011. These are maps of obesity across America to give you a sense of how well that's going. So this is 2011. The green areas have 20 to 25% self-reported obesity. Yellow is 25 to 30, and then the pale orange is 30 to 35. And then if you look at 2012, green's starting to disappear a little bit. 2013, we have a new color appear. That's 35 to 40% obese. 2014, 2015, 2016, not a lot of green left. 2017, 2018, 2019, we have a new color appear, and that is 40 to 45% obese. 2020, 2021, we have a new color appear. That's, oh no, that's the same color, not yet. I'm getting ahead of myself. Here's the new color, 2022. This was the middle of the pandemic, so we were all hunkered down, right? A little understandable, but you do see there is a new color that appeared, and that's 45 to 50% obese. This is the last year that I was able to find data for. But my point is, these behavioral programs where we're trying to get people to exercise and eat healthy, they're not working. And so what I think is left on this list of the causes of chronic disease is environmental factors. And my work centers around the question, how do we change our environment to make the easy choice the healthy choice? And that's kind of, I think, what you guys are here today to talk about and what Meg just talked about. So we have built America for cars, not people, right? This is real. When I first saw this picture, I said, no, that's like some artist rendering. That's LA, if you've ever been to LA. So, and then it's called, oh, okay, thank you. All right, stack. So, this is kind of tongue-in-cheek, but it's really not that funny, right? I don't know if you've ever seen this slide, but it seems like I'm preaching to the choir here. One of those runs on fat and saves you money, and one runs on money and makes you fat. And yeah, so where are our priorities, right? That's the question. And so I work in public health, so I talk about the connections between all types of transportation and health. So if you think about driving, you think about injuries, I think about air pollution, I think about greenhouse gases, and the connections between life and death and respiratory health, I think if you're not driving, then maybe you're being physically active, right? And then that leads to healthier cardiopulmonary outcomes. When I think about transportation, I also think about access to healthy food. People in Maryland, I'll show you, there are food deserts in Maryland. And if you don't have access to transportation, then the easy choice for you is probably the unhealthy choice. Transportation gives you access to nature, which I'll show you a lot of the health benefits of, access to healthcare. I actually, so one of the projects I worked on in Baltimore was transit equity. And I had a lot of people who worked in physicians' offices call me and say, my patients can't get to me. How can I help advocate for better policies around transportation and access to healthcare? So if you can't access healthcare, you're not going to be healthy, right? Access to jobs, education, improved social capital. So I did a little bit of a deep dive before coming and looked at how Marylanders get around. So 85 to 95% of us commute to work by car. 10 to 15% of households, however, do not own a car. So you think, oh, well, maybe 10 to 15% of households must be using bikes or walking. But no, only 5 to 8% or using public transit of Marylanders actually use public transit. And you might know this, but only about 2 to 4% walk or bike to work. So when it comes to walking or biking to work, we're doing a lot worse than we were maybe in Jack LaLanne's time. I should have asked if you guys knew who that guy was, by the way. So in 1969, almost 50% of kids walked or biked to school. And in 2009, that was at 13%. And that's not really explained by people moving further away from schools. In 1969, 40% of kids lived within 1 mile of school. And in 2009, 30% of kids lived within 1 mile to school. So there's something going on there. And maybe part of the problem is how we've designed our communities. Would you want to walk or bike to school if this was what your community looked like? It's kind of a joke, right? So we have to be smarter about how we design our environment. Are we making it easy to bike in these pictures? Absolutely not. I don't need to preach to you guys. So when I think about driving, I think about injuries and crashes or biking, right? And so in Maryland, we have about 110, 120,000 motor vehicle crashes every year. 35 to 40,000 people are injured. 500 to 550 people die. And 100 to 150 of those are pedestrians or cyclists. So I just kind of touched a little bit on driving and injuries. But when you drive, most cars are burning fossil fuels, and so they're contributing to air pollution, right? And in Maryland, we have 600,000 Marylanders who have asthma. So that's directly impacted by air pollution. Air pollution diminishes our lung function. That's an additional 200 to 400,000 people in Maryland who already have diminished lung function. Air pollution triggers heart attacks. We have about 30,000 Marylanders every year who have a heart attack. It causes adverse birth outcomes. Not a lot of people realize that. You know, the like air pollution and lung issues, yeah, that makes a lot of sense. Some people don't even know heart attacks have a very strong link to air pollution. But then birth outcomes is also linked to air pollution. There's about 8,000 adverse birth outcomes in Maryland every year. Increased risk of cancer from air pollution, about 30,000 people in Maryland diagnosed with cancer every year, and about 54,000 people in Maryland die every year. Air pollution is also linked to death. So I also, mentioned physical activity. Physical inactivity contributes to heart disease, diabetes, cancer, and obesity, of course. And it's associated with and this is in the US, $117 billion in healthcare costs every year. Only 1 in 4 adults in the US and only 1 in 5 high school students get the recommended physical activity that they should. And 21% of Marylanders report doing no physical activity above just their daily living in the past 30 days. So we have a lot of room for improvement. And so coming back around, how do we make the environment, how do we change the environment? Telling people to exercise isn't working. How do we change our environment to make exercise and healthy eating the easy choice? So this is some maps made by CDC. Hopefully the website will stay up. On the one with the blue is obesity in Maryland. So the lighter color is the less obese, and then as you get to the darker blue, that's higher obesity levels. The map on the right is physical activity, and you can see it kind of mirrors the map. So the darker colors in physical activity are less physical activity. This woman, Dr. Peterson, used to work at CDC, and she said if you could package physical activity into a pill, it would be the most prescribed drug on the market. Now, we do have these new drugs, Ozempic and Wegovy and all that, and who knows where those are going to take us, but I think it's just worth noting her quote. So access to healthy food. Here's a map of Maryland showing in purple and blue healthy food priority areas. So these are areas where people don't have easy access to healthy food. It's a lot, right? And so transportation and access to transportation can help that. A lot of people don't realize how good nature is for you. And actually, there's some physicians that are starting to write prescriptions to go out and be in nature. So if you come into contact with nature, it reduces these are all peer-reviewed, evidence-based things. It reduces stress, improves your sleep, reduces depression and anxiety, leads to people who report greater happiness levels, reduces aggression, reduces ADHD symptoms, reduced diabetes, pro-social behaviors, lower blood pressure, decreased asthma and allergy, better general health, smoother post-surgical recovery. If you are in a hospital bed and you can see green outside your window, you recover faster than people who don't see green outside their window. Isn't that interesting? Better birth outcomes, improved pain control, lower obesity, and longer life expectancy. I kind of feel like if you could package nature or into a pill, that might be one of the most prescribed pills out there. This is amazing, right? But some people don't have access to nature. And so these trails that we're talking about and you know, being able to put your bike on the light rail and go to a trailhead. I was talking to somebody before this. That increases people's ability to do this. And then access to healthcare, jobs, education. I mentioned I work a lot in Baltimore in transportation. One of the projects I was part of showed that, you know, building the Red Line connecting East and West Baltimore would increase access to jobs in Baltimore. And then this was an old commentary in the Baltimore Sun about how kids in Baltimore City, they don't have like a lot, they don't use yellow buses. They have to take public transportation. And so these children who, if they have to transfer, you know, a bus in Baltimore, if it's less than, I think, 6 minutes late, it's considered on time. So if you get to your transfer point 6 minutes late and your second bus has already left, but your bus is considered on time, then you're going to be late to school. And that happens a lot to kids in Baltimore City who are already maybe starting off with a lot of issues that this is compounding. And then the last item on here is improved social capital or sense of well-being. I had to look up, I'm like, what is social capital? A long time ago when I started talking about this. So social capital is the time and energy that people in a community have to improve their community. It's also the time that they have to network socially, to go out and talk to people, to be civically engaged, people who vote, who show up to town hall meetings. This is a measure of social capital. It's the time that people have to do recreation. And public transit and walking and biking are linked to increased social capital. So all of these different ways that I've just highlighted lead to improved health. And so transportation and health, to me, are inextricably linked. And if we can improve access to biking and walking and making those the easy choice, then we can have all of these health effects on cardiopulmonary health, on mental health, on, you know, all of the things that we just talked about. So I don't like to just be doom and gloom, right? There's hope. There's this whole field called healthy community design. And that the definition they use is it links destinations that promote health via transportation network that facilitates safe travel. I like to translate that into healthy community design makes the healthy choice the easy choice, as you've heard me say a million times. And this is from the Urban Land Institute. These are evidence-based recommendations for how to design a healthy community. And you can see some of the ones that I starred. It includes designing a well-connected street network at the human scale, providing sidewalks and enticing pedestrian-oriented streetscapes, providing infrastructure to support biking, yay, and increasing access to nature and facilitating social engagement. So there are ways to address this, and people like you who care and come out to days like today can advocate for that. So I'm grateful to you for the work that you're doing today, and to Bike MD for all of your work. So in summary, we need to make active transportation easier. It decreases the number of cars, which lowers injuries, it reduces air pollution, reduces greenhouse gases, it increases physical activity, increases access to healthy food, nature, jobs, and education, increases social capital, which all improves physical and mental health, which is, I'm in public health, as I started off, that's what I care about. And so I think it's just a tremendous win. I feel like I'm probably up here preaching to the choir. I hope that what I've done maybe today is to put a different frame around some of the topics that you guys talk about, more of like the public health framing, maybe giving you a couple little nuggets or food for thought. And I always like to acknowledge I borrowed slides from a couple of these folks, and my contact information is up there if you have any questions or want to talk more about it. And thank you for everything.
I didn't realize that going to meetings is making me healthier. I thought it was just going to aggravate it. Questions from people? We have a few minutes for that. Okay, I will start out. When we're in these meetings with our representatives and their staff, if there was one health outcome that we might focus on in terms of more bike infrastructure will bring X, what do you think we should focus on?
I mean, to me, if you look at like what's making people sick and killing us, it's chronic diseases. And so if you want to make a dent in chronic diseases in Maryland or in your district, then transportation is a really easy way to do that. That would be my number one driving factor.
Right, and active transportation.
Active transportation, yes. People moving away from cars toward active transportation. Yeah.
I'm wondering, for our localities, for Worcester County, for multiple counties, or for statewide, how could we pull down some of these data points that you've referenced as evidence and justification for improved infrastructure for active transportation?
So that the two maps that I showed where it was like obesity and physical activity, it was Maryland. You can drill down to county-wide, the county level. That tool is called CDC's Environmental Public Health Tracking Network. As I mentioned, it's still up the last time I checked. But like EPA has a tool that is down. US Department of Transportation has a tool that's called the Equitable Transportation Data Explorer, ETC. And that also has probably some relevant data points that you can use for local-based advocacy.
I would also share the resource. Our local health department is taking a page out of our state health department is taking a page out of this book as well, and has become a lot more active in walkability and active transportation. So reach out to your local health department and make sure they're taking advantage of those opportunities. The Maryland Department of Health Office of Chronic Disease Prevention is launching a walkability grant this spring.
Yeah, so departments of health and also departments of planning, a lot of them are on board with this too.
That map you showed.
Oh, thank you. The map that you showed that showed the growth in obesity by state over the last few years, the primary driver of that is diet?
Diet and exercise, yeah.
Got it. Thanks.
As an environmental person, I might also, I think this one's working. I might also argue that it's probably obesogens, which are these chemicals that we're all, just spewing into the environment and taking in, and but that's less. That has a little bit less evidence.
In the back there, you with the mustache.
Good morning. My name is Lisa. Transportation here for the Great Baltimore Sierra Club. The Sierra Club very strongly supports the Transportation and Climate Alignment Act. That's before the Maryland General Assembly now, and I urge my friends here to support that as well. We talked to our 3 delegates last night by Zoom, and this was one of the 3 top bills that we talked about. So, thank you for your presentation. That's extremely interesting. Pay attention to what you're doing online and your website.
Yeah, and as Allison, I think, said already, we're going to share these slides that Professor Latshaw has given us and post this talk on the web. And so when you're talking to your delegates and your senators, you can say, we have this whole resource, please, look at the Bike Maryland website and you'll be able to see all this information for yourself.
Just so we record it.
Okay. Thank you so much for the presentation. I was curious about, you mentioned advocating with physicians or, medical practitioners to help increase access for folks, thinking about advocacy and coalition building, the mention about the environmental groups. How can we get more involved with the public health groups? Is there a Bike Maryland equivalent in public health advocating for this? Are there meetings that they're going to that we should be going to? Could we bring them to these?
I love it. So there is a Maryland Public Health Association, and I think they would be eager to partner and work on this with you. So I can make that connection. My email's up there, yeah.
Hi.
It's just for recording.
Thanks for your presentation. I was just curious if you could point to anything that would demonstrate, like from a previous project or something, like a return on investment. So that way, it's easy to show linkages between all this stuff, but in reality, I think, decision makers need to be able to see. Yeah. If you have anything, a resource to point to where we could find those types of examples from previous investments.
Yeah, nothing comes to the top of my mind, but I agree. I think showing return on investment is a great way to talk with policymakers. So I can certainly try to dig into that for you.
No.
Jack?
Yes, adequate public facilities ordinances don't cover transportation of any kind in most of the counties in Maryland, especially active education. I've testified at multiple planning board and zoning board meetings, and I've never heard a public health official testify about some of the benefits you stated. At most, a traffic study is required that just says how many more vehicles are going to be on the road and whether there's traffic. Nobody ever talks about transit or bicycles or walking. So what can we do to help that?
So so in the U.S., there's a law that says every time you do like a major infrastructure project, you have to do what's called an environmental impact assessment. Some states, like Massachusetts, take that a step further and they say, we don't want to just know what the environmental impact, we want to know what the health impact is. And then some places are starting to take that even a step further and do what's called a cumulative impact assessment. And there's actually a bill before the Maryland legislature called Cherish, and it's for cumulative impact assessment. So what cumulative impact assessment, so environmental impact assessment would say, if you widen that highway, this is how much extra air pollution you're going to have. A health impact assessment would say, yes, and this is how much extra asthma or heart attacks you're going to have. A cumulative impact assessment would say, not only are you going to have those extra asthma and heart attacks, But this community that you want to widen the highway in already has 2 incinerators, and its cancer rate is twice that level of the rest of the state of Maryland. And so it sort of takes it a step further, and it looks at the context in which this infrastructure investment is being proposed. So there's at least one bill in Maryland this year that is trying to kind of expand a little bit and bring health more into the discussion.
One more question. Hold on. This is so we can record your question.
Hi, thanks. You have some great statistics there and some excellent studies. There's an organization I've gotten involved with called Cycling Without Age, and the things that they're doing with respect to people with mobility challenges, predominantly, I would say, older individuals at like retirement facilities and assisted living. Have you done any studies, or is there anything that you can show from an anecdotal standpoint? I think it's amazing just the impact on their mental health and on their ability to, get out in nature, kind of have that resilience that's built up as a result of just kind of that experience. I'm curious, one, if you've done any studies, if there are any studies, and ways to maybe translate some of that into an impact statement. For example, like the impact statements you were talking about, where locating a retirement facility next to a trail, or vice versa, a trail next to a retirement facility might improve some of the again, the longevity and things of that.
I am not aware of any studies of that, but I think that you all need to come tell us what studies need to be done. This is great. I think, and there might be some out there. I just am not aware of it.
All right. Well, thank you. Let's give another round of applause.